Hello, good afternoon, or good morning, depending on where you're calling from or joining us today. My name is Terrell Parker, and I'm an Associate Manager at NMAC Center to End Epidemics. Thanks for joining us today. During today's webinar, you will receive an overview of the Escalate project. You will also receive an overview of the 3 Escalate tracks, which are training, technical assistance, and learning collaboratives. And next slide. I'm sorry, but I can no longer see the slides. Thank you. Next slide. Next slide. Escalate, which stands for Ending Stigma Through Collaboration and Lifting All to Empowerment. Escalate is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services, HHS, and the Minority HIV/AIDS Fund, 100% funded by HRSA HHS. The contents of today's presentation are those of the authors and do not necessarily represent the official views of nor an endorsement by HRSA HHS or the U.S. government. Next slide. So what is Escalate? Escalate seeks to train and empower and build the capacity of participants to recognize and address HIV stigma within the Ryan White HIV/AIDS program. Escalate is a first of its kind training and capacity building initiative specifically designed to address HIV-related stigma that creates barriers at multiple levels of the HIV care continuum. If you've ever worked in a community-based organization or within a federally qualified health clinic like myself, then we often ask ourselves, we see HIV-related stigma, but how do we address it? And we hope that Escalate answers that question. Escalate was created to reflect the mission of NMAC and its relationships to the communities of color living with HIV. NMAC leads with race, as we know the burden of HIV disproportionately impacts people and communities of color. Next slide. So what is the purpose of Escalate? HRSA's notice of funding opportunity sought out projects that would meet the purpose of these 2 goals. Addressing stigma for people with HIV on multiple levels throughout the HIV care delivery system, including individual clients, organizations, and system levels. And secondly, the program also focuses on implementing various stigma reduction approaches. And it's important for us to emphasize that these are evidence-based stigma reduction approaches. Next slide. It's also important for us to highlight community involvement. Central to the focus of Escalate are community involvement and cultural competency. Why? Because we realize that HIV stigma is a multidimensional social issue with complexities and nuances. So we want to make sure that we discuss intersecting stigma-related issues. Escalate engage subject matter experts from impacted communities throughout every level of the project, from implementing the design of the curriculum to deciding the format to the technical assistance and learning collaboratives. We engaged over 60 subject matter experts from highly impacted communities so that we can ensure that Escalate centers meaningful community involvement. Next slide. Next slide. Thank you. So who specifically will Escalate engage? If we can go back 1 slide, sorry about that. Escalate will engage all Ryan White HIV/AIDS provider recipients and subrecipients. That means all who are funded by parts A, B, C, and D. This includes community-based organizations, federally qualified health centers, health departments, planning councils, and planning bodies. And we can stay on this slide for a second. So what communities will Escalate specifically engage? As we said, the Escalate project is core to the mission of NMAC. NMAC leads with race. So the Escalate program has a particular focus on reducing HIV stigma towards these communities and populations: transgender and gender nonconforming individuals, men who have sex with men, Black African American communities, Latinx communities, and American Indian Alaska Native communities. Next slide. And we wanted to be sure to stress this as well, because we've received several questions from folks asking, what if my organization resides outside of an EHE jurisdiction? So while Escalate will have a strong focus on recruiting participants from the 57 jurisdictions identified in the Ending the HIV Epidemic Plan, you can rest assured that even if you fall without one of those jurisdictions, you can still apply, as long as you are a Ryan White HIV/AIDS program recipient or subrecipient, and you are funded by Parts A, B, C, and D. Unfortunately, Parts F are not eligible for the Escalate project. Next slide. As I said, Escalate has worked with over 60 subject matter experts from highly impacted communities. In addition to our community partners, NMAC is working in partnership with APT Associates, NORC at the University of Chicago, and TRX Development Solutions. Each one of our partners has joined us for today's webinar, and they will be here to share and discuss their aspects of the project. Next slide. The Escalate model. It's important for us to describe the 3 tracks that support the individuals and the organizations that are working to mitigate and eliminate HIV-related stigma in their communities. So there are 3 different Escalate tracks that you are eligible to participate in. You can be involved in the new and innovative stigma reduction training. And this training focuses on reducing HIV-related stigma through evidence-informed interventions and strategies with an emphasis on cultural humility for HIV service systems, organizations, and individuals. And I'll be sharing more details about training shortly. You can also participate in our targeted, time-limited technical assistance, which is led by APT Associates. APT Associates has partnered with NMAC to provide targeted, time-limited TA for organizations over the 4 years of our cooperative agreement. APT will share more details about technical assistance later. And finally, our learning collaboratives, which is partnered with NORC at the University of Chicago. NORC will facilitate 2 learning collaboratives during the cooperative agreement using the learning collaborative model developed by the Institute for Health Improvement. And NORC is also here today to share more information about learning collaboratives. By having 3 distinct activities, Escalate ensures that the greatest number of Ryan White HIV/AIDS providers and organizations are learning about HIV-related stigma and the tools that we need to combat stigma in our clinics and within our communities. Escalate creates multiple points of engagement that meet the needs of community and making learning opportunities accessible. Next slide. So next, I will share a few details about training before turning it over to our partners. Next slide. But first, we couldn't be here today without the hard work and the diligence of our Escalate team. These are just the few folks. It really is a full NMAC project, and we're all supporting the great work of Escalate. But thank you to our amazing Escalate team for all of the hard work that you all have put in over the last year to launch the program. Next slide. Escalate training goals. If you are participating or you hope to participate in the Escalate program, this is what we hope that you gain from participating in the project. We hope that you learn about the impact of HIV-related stigma, that you learn the skills needed to engage in the often difficult dialogue that takes place within our clinics and within our communities. We want you to learn about the role of implicit bias and how that impacts our decision making and ultimately the health outcomes for people living with HIV. We hope that you will be able to demonstrate the skills necessary to engage in critical self-reflection, because one thing that our subject matter experts help us realize is sometimes we walk into situations with our own biases and within our own privileges. So it's important for us as people who work within the HIV workforce to recognize those privileges as well. We want you to learn about and be able to demonstrate the approaches, the strategies, and the methods to deepen cultural humility and cultural humble practices. Time and time again, once again, from our subject matter experts and from our community members, we heard just how important it is for providers to practice cultural humility if we want to successfully sustain individuals in care. Next slide. And as I said, Escalate is a monumental project. So we have lots of goals that we hope to accomplish with the project. We hope that you will be able to utilize an organizational assessment that we're developing that you can then take back to your organization and continue to do work that is going to reduce and mitigate HIV-related stigma. We don't want Escalate to be a one-time project that you're involved in, you get really excited and passionate about, and then you go home and you lose that momentum. We want to be able to provide you with the tools and resources to continue to do this work well beyond the training space. And we hope that each individual will be able to walk away to identify at least one area of privilege that you can practice self-reflection on, because once again, we want to make sure that all of the individuals working within the HIV workforce practice cultural humility. Develop an action plan. As we said, we don't want this to be a one and done training opportunity. We want to give you the skills, the tools, and the resources that you need to do this work to make the long lasting systemic changes that we hope to see with Escalate. And finally, we hope that you will learn and engage in self-care practices to support people, to support individuals who are providers and people living with HIV. We know that sometimes when we recognize something or when we raise a person's awareness, we also have to provide them with the tools for dealing with those things. So we want to make sure that we implement self-care from the beginning of the Escalate project. Next slide. So who is eligible to participate in training? One more time, Escalate will engage individuals, recipients and subrecipients in parts A, B, C, and D. That includes community-based organizations, federally qualified health centers, health departments, planning councils, and planning bodies. Unfortunately, as we mentioned earlier, Part F is not eligible to participate in Escalate. One more thing that we also want to point out, we want to make sure that you choose the Escalate track that is best for you or best for your organization. So participants who are ready for training are ready to create change within their organization, but they may not have the organizational capacity needed to create that change across their clinic or within their organizational setting. So if you're ready for that change, but you may not have the organizational capacity, Escalate training is a great opportunity for you. Next slide. Stigma reduction teams. If you have had a chance to preview our application, then you know that Escalate is a unique opportunity for providers and people with HIV to work together. So in order to participate in Escalate, you must form a stigma reduction team. Stigma reduction team will represent that collaboration between community and organizations. and it must consist of at least one person living with HIV. Once again, when you create your stigma reduction teams, it must include at least one person living with HIV. And it's important for us to make that point, and it's important for us to make the point that it must be a person who is receiving services from that organization as well. Even if you have people who are on your staff who are persons with HIV, it is still important for us to have one person who is actually receiving services from your organization serve on that stigma reduction team. Next slide. So, what are the benefits of participating in training? As we said, we want this to be a transformative and relational change. We want participants to be able to learn how to facilitate that change, not just in the training space, but when you go back to your organizations, when you go back to your clinics, or when you go back to your planning councils and planning bodies, how do you become a facilitator of that change? We also want you to learn to create change, not only within our organizations, but within the communities we serve as well, because we know that HIV stigma does not just stop within our organizations, but it also exists within our communities at large. We hope that once again, we stress the importance of deepening the practices and your awareness of cultural humility. As I said, once again, time and time again, our community members from highly impacted communities, our subject matter experts, talked about the importance of cultural humility. And lastly, we want you to be able to learn how to address internalized stigma as well. Next slide. So, what do we expect from you as an Escalate training participants? We know that Escalate training occurs over a 5-day period. This will be virtual. All Escalate trainings will be virtual for the remainder of 2021. In 2022, we will move to a hybrid version where some trainings will be virtual and some trainings will be in person, but for the remainder of 2021, all Escalate trainings will remain virtual. It is a 30-hour commitment over 5 days. In addition, you must attend 2 follow-up sessions as well. So some folks have asked, this is a heavy commitment. So that's why it's important for your organization to be on board, for your organization to support you in going through and completing this training, because as I said, it is a 30-hour commitment, and we do want folks to honor that commitment and be fully engaged throughout the training. Next slide. Here are the dates for our year 1 trainings. Training 1 will kick off August 23rd through August 27th, and that training is for the Midwest region. Training number 2 will kick off August 30th through September 2nd, and that training is for the Southern region. And training 3 will kick off September 13th through September 17th, and that training will take place in our Southwest region. We have several training dates that are forthcoming, and we are excited to announce them shortly. There will be other training dates for the remainder of 2021, and we have a full training calendar for 2022 as well. Some things that you can expect for upcoming trainings: Escalate en Español. Language justice is a priority for NMAC, and it is a priority for the Escalate project. So within a few months, we will be offering Escalate fully in Spanish for our Spanish-speaking constituents. We also, as we mentioned earlier, we will focus on several communities that are highly impacted by HIV, one of those communities being American Indians and Alaska Natives. So we do plan to host Escalate trainings in Indian country as well. And lastly, in case you are eager to become involved and participate in the Escalate project, and you're a little discouraged because you only saw 3 training dates and it may not be in your region, just rest assured there will be an Escalate training throughout all 10 of the HRSA regions. So you will have an opportunity to participate in training. So please stay tuned for more details. Next slide, please. How to apply for Escalate. If you hope to apply for our first round of trainings, please note that the Escalate application deadline is July 9th, 2021. It is very, very quickly approaching. So if you haven't yet, please be sure to visit targethiv.com/escalate to apply. You must include information on each stigma reduction team member at the time of your application. So we advise that you download the PDF version of the application first. We ask that you preview the questions to the application. We ask that you gather all of the information for the members of your stigma reduction team. And then we ask that you complete the application and submit. And with that being said, I would like to pause for a brief moment. And I'm not sure if we had any questions that we wanted to possibly answer very quickly, or if we wanted to transition to our partners to discuss technical assistance.
Terrell, this is Chip. You have a couple of questions right now we can throw out right now, I think.
Okay.
First one is Texas in the South or Southwest region?
Texas is in the Southwest region.
Okay. And is there an amount of people that you recommend to be on a team?
There is a maximum of 6 individuals, but you must have at least 2 individuals. And your team must consist of at least 1 person living with HIV and 1 Ryan White HIV/AIDS provider.
Okay. And just to follow up to the application, download the PDF to review it. Don't do it online. Download the PDF and then review it before you go in and fill out the online application.
Yes,
is that correct, everyone? Did I get that right?
Yes, correct. So when you click on the Target HIV site to go to the application, you can download a PDF version and preview the questions, gather your answers, and then we ask that you complete it online. We've been having a little bit of issues with our application online, so we just want to make sure that everyone submits a completed application. Any more questions for me, Chip?
There's one more. Provider being an MD, NP, or PA?
The answer to that question is yes. As you will notice, we really hope the goal of this project is to engage as many folks at different levels of the organization as possible. So we want folks who are MDs. We also want folks who are decision makers, your administrators. We want folks who may work at the front desk, folks who may be your social worker, because we understand that if we really want to create organizational change, we need buy-in throughout the entire organization. So the answer is yes, we would definitely love medical providers to be a part of the Escalate training as well, but we really want to think of who represents your full clinical or your organizational staff. Anything else, Chip?
Oh, yes, sorry. One more question. To clarify, the person living with HIV needs to be Ryan White eligible and in the services?
Yes, correct.
Okay, and no more questions at the moment. And just let everyone know there will be a Q&A section at the end if you do have other questions.
All right, thank you. Next, I will pass it over to our amazing partners at Apt Associates. Alexis, take it away.
Thanks, Terrell. Hi, everybody. My name is Alexis Marbach. I'm from Apt Associates. As Terrell mentioned, our team manages the technical assistance for this project. So Chip, you can move to the next slide. So this is the Apt TA team, and some of the folks are on the call today. And we'll be able to take your questions in the chat, and then we'll be able to answer live today to make sure that you have all the information that you need to hopefully apply and participate in Escalate moving forward. Next slide. So what is TA? TA is designed to be a time-limited, tailored program that's specific to each organization that applies. It's for organizations that have the capacity to tackle HIV-related stigma and have a specific challenge that they're dealing with, that they would like some really specific, tailored, customized, one-to-one approaches to deal with. So we're creating organizational level change through targeted work plans. So this is all very customized to the individual experience of your organization. We're going to offer TA in two forms. So this organization specific work and then cohort level. So you'll get to know some organizations that are dealing with similar challenges and hopefully create some groupthink to help solve them. So we can move to the next slide. So what will you get out of Escalate TA? You'll get individualized coaching. So you'll be matched with a TA coach from our team and then matched with a pool of subject matter experts with lived experience and history of working in the field to overcome individual level hurdles. So if you're dealing with something that's very specific to your local community, something very specific to your organization, we can help you brainstorm best ways to overcome those challenges. You'll get an opportunity to participate in co-learning. So you'll get to learn alongside other organizations that may be experiencing similar challenges. And then SMEs can help connect you with additional colleagues in the field who have maybe been in a similar situation and have created new policies, procedures, organizational structures, hiring practices that have helped them address HIV-related stigma in their local settings. We want to make sure that people walk away with tools. So not just high-level thinking of how you could potentially overcome a challenge, but what are the actual strategies that you can put in practice during the TA and then after the TA so it becomes a sustainable practice for your organization. We want to make sure that there's reduced time from innovation to practice. So reduced time from thinking about challenges, conceptualizing game plans to putting them into practice and getting measurable results for your community. We want to address gaps in practice, translate evidence to practice. We know that that's a big focus for the Ending the Epidemic initiative and for HRSA generally, making sure that we use the evidence base that's already been established and making sure that you can implement it in your local communities. So next slide. Okay, so that all sounds great. You're like, all right, I could see how that could work for me, but what is it actually going to involve? So like I mentioned, you're going to get matched with a trained TA coach. So that's going to be your point person, someone that you will be able to have monthly check-ins with. They'll help to create a customized work plan for your organization. So using your application and an organizational self-assessment, we'll create this customized work plan that will link SMART objectives. So we'll be able to see where do you want to be at the end of the 9-month TA engagement and create a plan to get you there and measure your progress each month. So again, that organizational assessment and TA work plan, monthly one-to-one check-ins, individualized trainings. So if your organization, maybe you need to get a group of people together to solve a problem, we can help facilitate those conversations and make sure they're in service to your work plan. We'll have ad hoc opportunities. So, as things come up, we're available to have additional calls, subject matter expert calls, office hours, connections with colleagues in the field, connections with colleagues at HRSA, other subject matter experts across Escalate to make sure that you get responses to your concerns. Once you have completed the TA, you might think, okay, now I've overcome this individual organizational challenge and I'm ready to do more. There's going to be the potential opportunity to join the Escalate learning collaboratives upon completion. And our colleagues at NORC are going to tell us a little bit more about learning collaboratives, but there's future opportunities to participate in the learning collaboratives. The other thing I should mention, which isn't captured on this slide, is that if you participate in any one of these activities, there's always opportunities, any of these activities being training, TA, and learning collaboratives, there are ways to participate in the other activities throughout the time period that Escalate is running. So you participate in TA, and then you hire some new team members. You think those team members really need to participate in training. You can send your new team members to training. You participate in training and then are ready to move to TA. You can go that way as well. You can go from TA to learning collaboratives to training. So there's no wrong door to getting involved in Escalate, and we hope that you'll find the right way that works for your organization. So next slide. So the eligibility and requirements are very similar to training in that we're looking for parts A, B, C, or D. You don't need to have all of the parts at your organization. And we're looking for stigma reduction teams with the same structure that Terrell mentioned when he was discussing training. We're going to ask for a demonstrated organizational commitment to address specific HIV stigma within your organization and community, and the availability to participate in TA sessions. So TA lasts about 9 months, and we're going to ask for about 3 to 5 hours from your organization per month to engage in TA activities with us. On to the next slide. So here's where we're at. There's the application period that's open now that Terrell discussed through July 9th. And then we're going to be making decisions in partnership with our colleagues at HRSA around applications in July. And then we'll begin TA in August. Then we'll lather, rinse, repeat this process starting in March. So we're going to have 4 total cohorts of TA over the Escalate time period. But the first one open now and ready for applications. I'm going to move to the next slide. Great, so here's the contact information that you can use to contact me directly about TA, but Chip, I'm wondering, have any questions come in through the chat? Any things that we can address now?
Oh, yes. Can you give an example of what type of stigma person would, can you give an example of what type of stigma person would be dealing with to apply for TA?
Sure. So we're thinking about what would be happening at an organizational level that may trickle down to the way that your clients experience HIV-related stigma or your community experiences it when they come into your organizational setting. So this might be related to something like an HR policy. You find that it's hard to hire people with lived experience, or you find that it's hard to retain people with lived experience. Maybe folks come on and then they leave pretty soon after coming on. So your main concern is around HR policies, practices, procedures. We can help you tackle that. Maybe it's around communication efforts. Your communications you find don't really address what's going on in your community. Maybe they don't reflect the gender identity of your community. Maybe they don't reflect the makeup of your clients and your community. So we can help you deal with communication strategies. Maybe it's outreach strategies. Maybe it's you don't have a great way of partnering with the community to get input on interventions or activities. We can help you figure out better ways of communicating with your community and engaging them in your work. Those are some ideas, but we're open to addressing any of the challenges that you may have. Any other questions?
No more at the moment.
Okay, great. Well, we'll keep monitoring the chat and happy to address other questions as they come up, but also please feel free to reach out. But I think the next person who's up is our colleague at NORC, Chris, who's going to tell us a little bit more about learning collaboratives.
So welcome, folks. My name is Chris LaRose. I work at NORC at the University of Chicago. If we can move on to the next slide, I want to just present some of the members of my wonderful team who are going to be helping out with the learning collaboratives over the course of the next several years. Let's move on to the next slide. I'm sure folks are wondering what exactly is a learning collaborative. And, by and large, a learning collaborative is an initiative where organizations come together to study and apply quality improvement methods to a focused area, sort of a peer learning opportunity, but it's also sort of led and facilitated by subject matter and quality improvement experts. They're typically 12 to 18 months. They include learning sessions, which are live interactive sessions where folks are discussing important topics relevant to the quality improvement or relevant to the subject that they're looking to improve on. And then in between those learning sessions, there are 3 or 4 month long action periods in which the organizations who are part of the learning collaborative can go back and implement practices and strategies, test them out, see what's worked, report back on what's worked, and then share the lessons learned. Let's talk a little bit more in the next slide about what the Escalate learning collaboratives are specifically about. So the Escalate learning collaboratives will specifically focus on supporting and testing the implementation of an HIV stigma reduction initiative at your organization that's aimed at reducing the impact of HIV stigma, as well as other types of stigma and discrimination that exacerbate the experience of HIV stigma. And this would be an initiative that focuses on a population or community that your organization serves. And so each LC will bring together organizations that are either at the stage where they are ready to implement or they're already implementing stigma reduction activities. They'll provide them with coaching. We're providing what we refer to as LC liaisons, for each organization. It'll provide them with the opportunity for peer-to-peer learning, collaborative tracking of progress over time over the action periods that we mentioned, and as I also mentioned, support from stigma reduction subject matter experts. Let's move on to the next slide. So we're planning to implement 2 learning collaboratives over the course of the Escalate project. Our first learning collaborative, which is the one that we're hoping that folks are applying for now, will be starting soon, running from July 2021 all the way through to August to September of 2022. We're hoping to attract 8 organizations to participate in that. And then the second one will run from winter 2023 to summer 2024 with another 16 organizations. Our first learning collaborative will focus on cultural humility. I mentioned the learning sessions. I want to note that the specific dates of the learning sessions will be selected closer to the launch or the close of applications. Or the specific dates for LC2 will be selected closer to the launch of the applications for LC2, and the specific dates of the learning sessions for LC1 we will be selecting once we hear back from folks who have applied and been accepted in the program. Now, LC2 will focus on another aspect of HIV stigma. Again, that's going to be informed by the interest expressed in the LC2 application and in lessons we learned from developing and implementing LC1. So moving on to the next slide. What are the benefits for those of you who are interested in participating in the Learning Collaborative? You will receive support for implementing strategies to address HIV stigma. There'll be opportunities to learn both from experts as well as other organizations implementing stigma reduction initiatives that are focused either on the same populations or on the same types of stigma. There'll be coaching to overcome hurdles, and there'll be opportunities for co-learning, knowledge creation, and support from like-minded organizations. What this will provide you on the next slide are tools to evaluate your progress and assess improvements. It will hopefully lead to stronger, more effective, more responsive stigma reduction initiatives. a reduced time from innovation to practice. So from when you start planning a program to when you're implementing it and implementing it successfully. And then this will also provide an opportunity to address gaps in practice, translate evidence to practice. If there's a particular approach that you've read about that you'd like to implement, this will assist you in that regard. And then overall to achieve common goals related to stigma reduction. Let's move on to the next slide. So for those organizations who are selected to participate, very similar to our colleagues in training and TA, we are looking for a primary point of contact who we're going to refer to as the stigma reduction change agent. We are also looking for a stigma reduction team, which is 3 to 5 members of the organization. We do, as with the training folks, require one individual who represents members of the population that your stigma reduction activities focus on, as well as people representing a wide range of roles and seniority within your organization. So we want both client-facing staff as well as administrative staff in order to make sure that the stigma reduction initiative that you're working on, that you're planning, that you're implementing has the widest impact. And so we recommend that there's a wide range of staff involved. Let's move on to the next slide. So we also recognize that for our learning collaboratives, they will be convened over a 14-month period. We estimate the team members will need to devote approximately 6 to 10 hours per month specifically for participation in the learning collaborative. And this is over and above the work that we're assuming that folks are already doing, implementing a stigma reduction initiative at their organization, and that time will vary depending on the intensity of your efforts. Successful participation in the learning collaborative will require engagement in live and virtual meetings, as I've mentioned, check-ins with our coaches. As I mentioned, we're referring to those folks as our LC liaisons. Affinity group webinars, which are webinars for smaller subsets of organizations who might be grouped according to the population that they serve, the approach that they're taking, the type of stigma that they're working on, as well as regular evaluation activities, which include meeting your team and completing quality improvement forms. What's next on the next slide after applying for the LCs? As we're in the midst of the application season. We anticipate that applicants will be notified of the decision about whether they're selected or not in mid-August. From mid-August to early September, those organizations who are selected will be asked to review our member packets. It's sort of resources that will help with participation in the LC, to complete some pre-design meeting evaluations. A design meeting is one of the first meetings that we have, and to complete the tracking form, the PDSA form, Plan, Do, Study, Act form, for the first time, and that's required between the design meeting and the first learning session. We're anticipating holding our first design meeting, or our design meeting, in early September, and then in late September, our learning session. At the design meeting, we're anticipating the LC members or organizations will, collectively decide on performance measures that we will all agree to, and on an LC charter that spells out what we're hoping that everyone is willing to bring to the table. And then for our learning session, which is a little bit longer, we anticipate that, and these will be all of the learning sessions, that the LC member organizations will participate in a learn segment where we have a subject matter expert from the community, from academia, from the professional world, describe stigma reduction strategies that they have implemented and what's worked and what's not worked. A segment called Share, where organizations will share their experience with each other. And then a segment where we are comparing the metrics for all of the organizations that enables you to look at your organization versus how other organizations are doing, and adopt different practices, test out other practices, etc. So I think it's at this point I'd like to check in with Chip and see if we have any questions.
We have one question right now. Is there any wiggle room around number of required participants for these LCs? I work at a small organization, may not be able to enlist 3 or more staff participants.
We can discuss that if we can at least have, I'll say 2 or 3 folks, definitely one of them being someone from the population that is served by that organization. That's an option. I think the other thing to consider is, are there staff at organizations that particular person works with, that you could form a group that represents 2 organizations, a coalition. Any other questions?
Not at the moment, no.
All right. Well, I'll hand it back over to Terrell in that case. Oh, sorry, to John. John, can you hear me? You're, I believe you're presenting next.
Okay, can you guys hear me now?
Yes, we can hear you, John.
All right, good.
We can't see you, but we can
well,
hear you.
Not sure why that's the case, because I'm clicking the little icon for the video, but if hearing me is good enough, that's okay. And if Chip can figure out how to make me appear, then that'll be fine. But if you guys can hear me, I think that's good enough for now. And we can go over to the next slide. Okay, my name is John. There's a little picture of me. And this is our organization, TRX Development Solutions, and now my video's up. We are the evaluation team for Escalate. And I'm going to talk to you for a few minutes about what that means and what we do. You'll meet some of us, but by and large, evaluation kind of operates a little bit behind the scenes, and you'll find out why in a minute. Can you advance the slide? Okay, so one of the things that HRSA and the Ryan White program really wants to do with Escalate is understand its effectiveness, understand how we did it as we're doing it, understand what folks are learning, understand when folks bring back strategies or tools to their home agency or community, what kinds of things did they encounter when they tried to act on them? Was it hard to do? Were there barriers and challenges that you had to overcome? Were there ways and workarounds that you engaged in order to achieve the result you wanted? We want to learn all of these kinds of things to help understand by the end of Escalate, at the end of the 4 years, how these tools, practices, strategies, etc., can continue to live in the community, that folks can continue to utilize them in Ryan White agencies, and continue to understand how to reduce stigma when they encounter it in their community, HIV stigma and other related stigmas that impact our community members with HIV. So in this case, what we are doing is the following. We're using an implementation science framework called RE-AIM. And there's 5 initials, and it means that we focus on elements of the implementation of Escalate, as well as the tools and strategies you will learn about, to understand their reach. How have we reached out into the community? That includes both the community of participants who are signing up for training, TA, and learning collaborative participation, but also the communities we serve. through the Ryan White organizations. We're going to look at the effectiveness of the strategies and tools you bring home, as I said, and the training to help you understand them. Adoption and implementation, and that goes to, was it hard to do? Were there challenges, barriers, that kind of stuff? What kind of supports did you encounter or need? And that includes also supports that we didn't know were there. In implementation, you can learn a little bit about, oh, that's part of my organization that really helps to make this possible. I didn't think of that beforehand. We'll want to learn about that. And then maintenance is the idea that we want to know how you can sustain stigma reduction programming over time and strategies, okay? So we're going to be doing some activities to help learn from your experience in Escalate, because the evaluation is an evaluation of the program and the tools, and we only understand that by understanding the experience of the folks who participate in the program, in training, in TA, or in learning collaboratives. Evaluation is not about evaluating you guys. It's about evaluating the program, the process, and are we doing what we think we're supposed to be doing, okay? And to that extent, we are going to be interactive with the program staff. They're going to learn from your experiences over time. They may modify and be able to change and adapt some of the strategies they're teaching you over time. We're going to help them develop tools through the evaluation, tools to examine how people experience cultural humility in Ryan White's organizations, tools to learn about how do we understand where our organization is with regard to stigma reduction. Are we doing it already? Are we ready to do more? What could that be? Other tools that you can bring home from training that help you recognize and intervene when stigma occurs and create processes that will help to address it. So that's the purpose of our program evaluation. And if we advance the slide, we can look at how we're going to do that. Okay, so as I said, we are learning from the experience of the participants in Escalate. Everybody who comes through training, TA, or the learning collaboratives will help us understand how we're doing our job, how to do it better, and what tools are most effective. And so we are going to be collecting information from you guys at different points and in different ways. The first and the main thing that we're doing is that we're going to have program survey that we're calling the Escalate Survey and Self-Assessment Tool, ESAT. You will experience this by following a URL link that'll take you to a survey platform where you'll answer some questions. All the surveys that we're doing, because surveys are not the most interesting experience that people can have, so we're trying to keep them short and sweet. All these surveys should take 10 minutes or so or less. They're not long, they're not lengthy. They don't go into your personal experiences in your life, so to speak. They go into your experience of the program. How do you feel about what you've learned? Do you think you're able to use it? How was the facilitation process? Were you able to get your questions answered? And things like that. And to do so, we want to learn from you at different points in your experience, because Escalate is a journey. It is a journey from the time you begin a training or TA or an LC to when you've concluded the program activity, and then afterwards, as you're trying to implement what you've learned out there in your community and your organization. So the first thing you'll find is that at the beginning of your program, whether it's training, TA, or LC, one of the facilitators, who you met some of just now, Alexis, Chris, and Terrell, and a few others, they are going to introduce you to the pre-program survey. They will go through what we call a consent document that'll explain what it's about and allow you the opportunity to say yes or no to participating. We do hope you say yes. And then you will have a link that you'll follow. You'll be in your virtual experience, but you'll follow a link in your browser to the survey. You'll take that pre-programmed survey, which will be about what kinds of experiences and knowledge and thinking about stigma are you bringing in to the program. We'll learn a little bit about your organization, what kind of training you've received before, a little bit about your team, okay? And that'll be the pre-program survey. Now, at the end of your program activity, so Terrell said it was a 5-day training. So on day 5 at the very end, or in the TA after whatever the conclusion of your individual plan is, whether it's 3 weeks or 8 weeks or whatever, and in the LC at the conclusion of that after a few months, you'll have the post-program survey. In that one, we're going to ask you how you feel about the experience. What do you think you've learned? How capable do you think, or how comfortable are you going to be trying to utilize this knowledge and experience out there in the world? Things like that to understand your experience with the material and your own self-assessment of what can I do out in the world with this knowledge. And so then that'll be at that point. Now, 3 months later, particularly for, well, 3 months later in general, but before that, the training has a couple of follow-up activities. So you have a second post-program survey and training, same kind of stuff. How do you feel about what you've learned? When you tried to utilize some of these experiences at home, how difficult or easy was it? And then for people in TA and in the training, 3 months after your experience, we will ask you one last time. And in this one, there will be some different questions because we'll want to know things about when you tried to utilize the kinds of things you learned. What were the challenges? What were your workarounds? How did you overcome them? What were the supports you had? What were the supports you wished you had? Things like that to help us understand how well these strategies work and what we need to make them really able to be replicable and available so that others can use them in the future without necessarily having to go through the entire training process. So we're trying to learn from your experience how to equip others with these kinds of strategies and tools. And as I said, each of these is going to take less than 10 minutes. They will not be long surveys, and they're not particularly invasive of your personal life and experience. They're really about what's happening in the program. There's a second instrument within the survey and self-assessment tool that you will use as an individual in different times and places. It's called the Escalate Organizational Self-Assessment. And it's a little bit longer. This one does take probably 15-20 minutes to fill out. What you're going to have in training on day 5 is that the facilitators are going to train you about what the EOSA is and how to use it. They'll ask you to complete it, and then they'll talk to you about your experience. And we're going to learn with you about how to self-assess an organization by asking you questions about, does your organization do this? Does it do that? How do they support staff in terms of training for this and that and stigma? How are the communities supported? And when Alexis talked about, you might think about your communications, reaching the community. We'll have some questions about that. How do your public-facing material reflect the community you work with, and so forth? And that's an attempt to learn and to help people help themselves learn about where their organization is with regard to stigma reduction. And that'll be part of the training package. So it's not separate. It's an evaluation tool that's integrated in with your experience. And it'll be utilized with TA and learning collaboratives in some other ways, okay, as an individual tool. However, the other thing we're going to do is that we are going to look at the results from the program surveys and talk to the trainers and the TA folks. And we are going to ask some organizations that participate in Escalate if they would like to be part of a facilitated Escalate organizational self-assessment. That's when you will finally get to meet some of the evaluation team, because if you do, it'll be about a 3.5-hour segment where your team and our team will look at the EOSA together and come up with answers and ways to address stigma reduction and the assessment of it at your organization as a group, as a community, to try to learn together, to try to develop answers to questions about how ready are we to engage in further activities to reduce stigma, and in what specific areas could we focus that activity. We are also, and that'll be a facilitated Escalate organizational self-assessment. We'll do reports on that, and we will learn from your experience. We're also going to do some case studies, particularly of organizations that participate in TA and the learning collaboratives. We will work with, we being the evaluation team, with the facilitation teams at APT and NORC to be able to ask some organizations or teams if they would like to participate in a case study. All of this is voluntary, the facilitated EOSA or the case study. We will only work with those organizations that would like to work with us on it. And in those cases, we're going to be documenting your experience to try to learn as much as possible about how these tools and how these stigma reduction practices actually work. Because at the end of the day, our job is to report back to the Ryan White program, to HRSA, to our Escalate partners, what kinds of tools and strategies really work, and can we start thinking about disseminating them more broadly out in the community so we can support stigma reduction more broadly over a longer period of time and way beyond the time that the Escalate process is itself a fading memory in our lives. So we're trying to learn with you and from you on how to do this the best way possible, and that's what evaluation's about. As I said, everything is voluntary in the evaluation. You will have a consent process, and you can remain in the program, learning in your training, your TA activity, or your learning collaborative, even if you decide not to participate in evaluation. We are making the evaluation process, I hope, as simple and smooth as possible so that you'll want to, because we can't learn without you. At the end of the day, we want to be able to tell the world about our project. The Target HIV website should be full of these tools and this learning that we get out of our case studies and our facilitated Escalate organizational self-assessments, out of survey results that will be reported in the aggregate and anonymously, so nobody's going to be identified in that kind of reporting out. And we'll be able to disseminate what we're learning. We hope that we can publish this. We hope we can take it to the world and really document it so that people can understand with us how we've learned to reduce stigma and what really works in order to do so. That's what the evaluation is about, and that's how we're going to go about doing it. So I'll just stop and say, Chip, do we have some questions about this that I can address, or can the evaluation team go back to hiding behind all the facilitators that are so wonderful in our process?
We do have some questions. I think we've gotten to the point now where we can just go into general Q&A. So nothing specifically about evaluation yet, but I think we can go into the general Q&A session right now. So give me 1 second here. And okay, everybody still there?
Yep.
So we do have a few questions. Everybody can come back on their cameras if they haven't already. So we had a couple of questions that came up under the LC. So I'm going to direct those to Chris. One of those is, does it have to be related to cultural humility? Can you give an example of what types of things an organization would work on to address this? Chris, you're muted.
Sorry, can you hear me now?
Yes.
All right. So for LC1, it does have to be related to cultural humility. That was sort of a topic that was sort of pre-selected for us. In terms of things that are related to cultural humility, I think it's going to be about staff interaction with clients, demonstrating that they are open to listening to clients, open to learning from clients, etc. Now, it can also include spreading principles of cultural humility beyond the staff at your organization, potentially to the staff of organizations to whom you would refer clients.
Okay, the next question also for under LCs, would board members be good in these spaces?
It would be helpful to have someone at a level where they can definitely make organizational change, and someone with the leadership and the clout or gravitas to make that change. So I could see board members, if they play that role, being an excellent team member.
General question for all. Can a staff member who is living with HIV but not currently a Ryan White client participate in these interventions, or must the PLWH be an active consumer of Ryan White services?
That is, I can answer that question, y'all. Yes, you can participate. You participate as a staff member, but if a staff member is HIV positive and is disclosed about it, you may participate in some cultural humility survey part that also other people with HIV might address, but you'd be participating as a staff member. Also, if you are a staff member who is positive but not disclosed and would prefer not to, you don't have to, but you can definitely participate. You'll be participating as a staff member, but also experiencing Escalate as someone with HIV. And so if you do answer a question on the survey, which is anonymous and private, that says, I have HIV, then we might ask you to do some cultural humility questions as part of your survey experience.
Okay, next question. The application for Escalate suggests that it's suggested to have someone who's lived experience, but not necessary. We obviously want to include people who've lived experiences as much as possible, but could you clarify?
Yes, it is required. It is a stipulation of the program. Your application will not your application will be considered incomplete if you do not indicate that there is a person with lived experience on your stigma reduction team.
And if I might add one little iota to that, one of the reasons that the training team really emphasizes this and that it's part of the requirement is that the methodology of training in this involves having people in the room together who have the lived experience as well as who are providing the services, so that common understanding can come to bear in the process of participating in training. That's like woven into the fabric of the Escalate process.
And then I think it's also important to stress the fact that we do want a person with HIV who is not affiliated with the organization, who can really give an unbiased, unfiltered, personal perspective of what it's like to deal with HIV-related stigma without worrying about the implications on their job. So it is important for us to have someone who is not affiliated with the organization.
And if I could also add to that, for the TA and LC components, while we very much do want someone to participate in the team who is a person living with HIV, person representing the communities or populations being served by the organizations, you do not have to identify who that person is. You just have to acknowledge that that person is included in the team.
Okay, next question. There seem to be a lot of moving parts in this initiative. After completion of the program, what does implementation look like in terms of human and financial resources?
That sounds like a question for HRSA.
Yes.
I can take the first pass at this if other team members want to add. I think, yes, it is a complex initiative. And so over the course of the 4 years, there are multiple ways of participating in Escalate. So each organization's path is going to be a little bit different in what they end up implementing and what sustainability looks like. But the training TA and LC teams are committed to helping the organizations that we work with develop sustainability plans from day one. So when you work on your TA work plan, when you work on your training work plan, your LC charter, you're going to be talking about what does sustainability look like when we transition you out of this initiative. So that is an active thing on our mind, and we can have further conversations with our colleagues at HRSA about what the initiative, the work of the initiative will look like in, is it 2024? Friends?
Yeah.
Yep, 2024 when we start to roll off of this project. More to come on
And also during the program, we should say that once we get to hopefully get to physical sites or actually doing in-person training events, the participation of folks in that in terms of travel, lodging, and meals is paid for by Escalate. The HRSA and the Ryan White program has been incredibly generous in helping to structure a program that will not cost anyone anything, including the community members, to participate in active live events during the program. There is a cost for those of you who are department managers, et cetera, at your organizations in terms of some days lost of people who will have to commit that. However, the travel, the lodging, the meals, that's taken care of for people once we get, and hopefully soon, to doing things in the real world again.
And thank you, John. I just want to take the opportunity to say, even in the virtual space, we're trying our best to make the trainings accessible. So for folks that don't have the internet, we are going to be sending out mobile hotspots. We also have ordered a select number of iPads for folks who may not have the technology to access. So we really want to increase access and make this as accessible as possible for participants. And that's why, as John said, when we move to actually doing the trainings physically in person, meals, lodging, travel for participants will be covered. So that's another advantage of the Escalate project, I would say.
And to sort of piggyback off of what my colleagues have said, I don't necessarily view it as days lost, more like days invested in getting a program at the end of this to make sure that your organization is meeting the needs of PL-HIV without costing them access to services, access to support, because those programs are not delivered in a stigma reducing, stigma addressing sort of way. So, I think one of the slides that both our TA colleagues and we shared talked about how you will end up with programs that are better able, stronger, and more effective in serving communities who may be currently stigmatized because of HIV and other related stigmas.
And I dropped this in the chat, but we want to make this accessible and sustainable for you all. I think that I can speak for all of our colleagues on the call that we're in service to you all. So whatever we can do to make it easier to participate, if there's something that you need, a question that you have, we're all always available to help you address HIV-related stigma, to break down barriers to participating in trainings, to increasing dissemination opportunities. Whatever you need, we are here to help.
And one last bit, as I said when I was talking about evaluation, we're all very serious about learning from you and with your experiences, so that Escalate can, at the very least, provide to the world after these 4 years documented facilitation manuals and other resources concerning tools for increasing cultural humility in agencies, for reducing stigma, for helping agencies to develop policies and procedures that will formalize commitments to reducing stigma and so forth. So the evaluation part will help us learn how to keep this moving after, or at least after 2024. And those of us in it will probably try to lobby real hard to see if we can't continue doing this kind of work, because it's super important.
Absolutely. Any more questions, Chip?
Oh, yeah. We have a question here about the slides being shared with participants. The session is being recorded. The recording will be available on the NMAC website tomorrow. All of you will receive a follow-up email with the link tomorrow. So we'll be available for you to view at your convenience. One question, what region is Ohio in?
Ohio is in the Midwest region. So that would be the first training date.
Okay. We are a peer-run and led social organization. We don't receive Ryan White funding as an organization, but our board is a working board and some members receive Ryan White. Are we eligible?
I would say, and I'll take a stab at it. My best thing would say would be to partner with the community-based organization. And if there are people with HIV who are a part of that organization, maybe you can join a stigma reduction team of another community-based organization or clinic planning body. John, did you have something you wanted to add?
No, I was thinking along the same lines, or just that, I think we can try to take some intentionality into the application process, and if we get some applications that look a little like that, try to help folks find an organization too. I don't know if that's too much for us to do, but it's a thought that occurred to me.
I think it's definitely possible.
Okay. Next question. Will organization members be included in publications, included as contributing authors in articles that will be published from this initiative?
There's that. That's not in the plan right now because the partners are putting this together, and we will just be putting together aggregates of data from all of the surveys. So at that level, probably not. If we do case study publications, then that's probably a possibility because we'll be working closely with you on that. So the more kind of smaller scale stuff, that is definitely possible. But in terms of reporting survey results from across Escalate, we are hoping that there's dozens and dozens and hundreds of organizations that'll be there. So our survey results will be reported in the aggregate. However, as I said, I think when it comes to case study stuff and the facilitated EOSA, the stuff that we're doing with a very hands-on work with a limited number of organizations, that's definitely something that we can make sure to take into account.
Okay. Bear with me. This is a long one. So I have been thinking of doing an in-service that we take every one of our 3,000 hospital employees, teaching them about U equals U, PrEP, how HIV is and is not spread, and the prevalence of HIV in the South. My idea is that if we can teach 3,000 employees real information about HIV, and they teach 3 people outside of the hospital, we will help to make an impact at decreasing stigma that is spread by false information. Does this type of project fit anywhere in any of your programs?
I think that it could fit in with TA. I'll just speak from like my own zone of influence. So I'm thinking that your organization, maybe the challenge is embedded in-service trainings about HIV prevention and stigma. So what we could work on together is figuring out how to get the organizational buy-in, the structures, all the things that you would need to train these 3,000 people. And then how can you use, essentially, it sounds like a diffusion of innovation model a little bit, like you're gonna have these people who are gonna be empowered with this knowledge, and then they need to tell, or maybe it's more popular opinion leader, but basically people who have knowledge who are going to then spread it to a few more people, who are then going to spread it to a few more people. So we can definitely help you craft programs like that through TA.
So, and I just want to follow up on that. One, POL is very much based on the diffusion of innovation, like DEP, like many of the EPIs that I'm sure other folks are familiar with. Where the break becomes from TA to LCs is perhaps TA would help you gain the buy-in, develop a plan for implementing it, develop a plan for evaluating it. But when you're at the point where you're actually implementing it and it's going, and you want to learn from other organizations who are doing similar things, that's the point where you would look to be engaged in the learning collaborative.
It's a great question.
Okay, next question. Will there be some considerations around type of organizations and or providers who will be selected to participate?
Yeah, so across training, TA and LCs, we're going to be looking across the regions for training, look at to make sure we have geographic diversity, and then for TA and LCs, we want to have diversity across the entire country. We'll be looking at size and scope of organizations. We want to make sure that we get a group or a cohort together for each training TA LCs that is diverse enough to challenge each other, share experiences, grow from one another, and not just create one uniform experience, which is what's great about Escalate is that it lather, rinse, repeats a few times. So if it doesn't work out this application cycle, we can make sure you're prepared for the next application cycle. But yes, we do want diversity across the applicants. But John, I saw you going to raise your hand.
And the other thing too is this, the size and scope of Escalate is pretty large. We are equipped to handle about 1,000 trainees across the next through 2024. So the training program cohorts are supposed to be around 25 to 30 people per cohort. And so that adds up to a lot of people. I think 60 organizations are slotted for TA. Is that right, Alexis? Yeah. And then, as Chris said, 8 LC organizations the first time, 24 the second time. And you can participate in multiple ways. An organization can do all 3 if you apply at the right times and it's a good fit for you. Also, if you're a large organization and you'd like to send 3 or 4 people now, but do another group next year and another group the next time, you can do that. You know, if you're super gung-ho, and again, this might be something where the folks who are asking about getting hundreds and thousands of employees trained, if those guys are in Ryan White organizations, they can come to the training. So, and an organization can train just about as many people as there are spaces for. So it's designed to be really big and comprehensive and able to accommodate the whole Ryan White universe. Have to hand it to HAB and the Ryan White program. They were thinking big when they put out the notice of funding opportunity for it, and we hope to deliver with you.
Absolutely. This is an amazing opportunity for your organization to commit to reducing HIV stigma, and you have several ways of engaging.
And can I add one more thing about the application process, because I know we're getting close to the end. Chip, are there more questions to do first?
There's one more right now. For PWH non-English speakers that may wish to participate but are restricted by language barrier, does Escalate have any plan to address that and make the project accessible to such potential participants?
Yes, so translation will happen from English to Spanish. We're actually in the midst of doing that right now. And we do anticipate that within the next year, we will launch Escalate in Espanol for our Spanish-speaking individuals.
Okay, no more questions at the moment.
So the last bit is just concerning the applications, and we just want to reiterate one more time. There's PDF copies of the applications. There's one for training and another for TA or LC. It's one application for both of those tracks of the program. The PDFs, you can download them, and we ask you please download them and give them a read, because you'll see that there's a certain number of questions, and you might need to go find the information. If you are getting into the application process and you start it, we'd like you to be able to finish it. You can start it and stop it, but one thing we would ask people not to do is try to click through the whole application online just to see what's in there. We have PDF documents for that. You can sort out all the info you need so that you can come in and do your application all at one time. So please be aware of that and utilize those PDFs to figure out what we're asking you to think about when you apply.
Okay, we've had one more question come in. Any other languages besides Spanish?
Currently, the current plan only indicates Spanish.
And no more questions right now. Going once, going twice. Okay, I think we are done with questions.
All right. Well, thank you for joining us. Chip, I don't know if you wanted to share the last slide with our contact information in case anyone wants to reach out. As we said, applications for our current cycle are open until July 9th. Please feel free to reach out to any one of us directly, and we can answer any questions that you have related to the Escalate project.
We also just want to take a moment before we wrap up to thank our colleagues at HRSA. We know some of them have popped in and out of this webinar a few times today, but we've had great project officer support from our project officer, LaQuanta, and her colleagues, Marlene and Natalie, and Stacy and Pam have also been incredibly helpful to us. So we're grateful for their investment in this initiative and for their support, and look forward to working with them for the next 4 years to help to reduce HIV-related stigma in our communities. Anything else, team?
That's all. We look forward to receiving your questions.
We do, and your applications.
Great. Thanks, everybody.
Bye.